For the first year of MBBS, there are 5 AETCOM modules. First module is what does it mean to be a doctor? In this module, the first year MBBS students will get acquainted with the holistic view of their profession. The students will come to know role, responsibilities and privileges of being a doctor. Being a doctor, we hold certain responsibility towards our profession, towards the community we live in, and the healthcare team we work with. So, at the end of this session, the students should be able to enumerate and describe professional qualities and roles of a physician, describe and discuss commitment of lifelong learning in physician's growth, describe and discuss the role of physician in healthcare system, identify and discuss physician's role and responsibilities to the society and community. An Indian medical graduate possessing requisite knowledge, skills, attitude, values and responsiveness may function appropriately and effectively as a doctor. Indian medical graduate should be a good clinician, leader, professional, communicator, and lifelong learner. Being a clinician means the doctor should strive for disease prevention, health promotion, cure, pain and distress alleviation, rehabilitation, and palliation. Being a leader is to be a member of healthcare team. So the doctor should respect the opinion and motivate other members. A physician should obey the prescribed ethical and legal codes of conduct and practice and be professional. A physician should effectively communicate with patient, family, colleagues, community to improve patient satisfaction. And a doctor should be a lifelong learner. A physician should continuously endure to acquire new knowledge and skills and apply them to patient care. In this slide, we can see the 6 fundamental principal qualities of a doctor. So the first quality is altruism. Altruism means to think of best interest of the patients over self-interest. That is selfless concern for well-being of others with no expectations or rewards. The second quality is accountability, to justify and take responsibility for one's action. A culture of accountability is a must for healthcare system. It will improve the doctor-patient trust. It will reduce the misuse of resources and help organization to provide a quality care. The third fundamental quality is honor and integrity. This will help to build trust among the patients. Consistently adhering to the principles of professionalism is integrity. The next quality is respect for others. Believing that the patients also have value and a behavioral dimension. Respect for their dignity, for autonomy, for privacy and confidentiality. Recognition of unconditional values of the patient as person. Fifth quality is excellence. Understanding needs of a patient and putting those needs in context. It is a commitment to maintain up to date knowledge, skills needed to treat their patients. And the sixth quality is duty. Doctor owes certain duties of care to his patients. Patient care, patient safety, quality services is the first concern of a doctor. So the 6 essential professional qualities of a doctor are altruism, that is best interest of the patient over self-interest. Accountability to the individual patient, society and profession. Excellence, is the conscientious effort to exit normal expectations and be committed as lifelong learner. Duty is the free acceptance of committed to service. Honor and integrity are the highest standards of behavior and refusal to violate one's personal and professional code. And last is respect for others. Respect for patients, their relatives, nurses, students, colleagues is the essence of humanism. So a good doctor should be caring. What does patient care means? It means to prevent medical errors, improve the health for better patient outcome. Then the doctor should be inquisitive. So doctors should take interest and should be curious in learning new techniques for the benefit of patients. Then doctor has to be civic minded. Doctor should be interested in what is going on in his society, in his community. Then doctor should be organized. Doctor should systematically plan for the treatment and management of the patient. Doctor should be a good communicator. So physicians spend time with the patients, listen to their stories and how illness affected their life. It is presumed by the patients that an expert communicator is a technically sound doctor. So by being a good communicator, you have to fulfill the expectations of a patient. Then the doctor has to be empathetic, to think ourselves in the place of patient. If we be empathetic, patient offers detailed history. They are more satisfied, they are more adherent to the treatment plans and less likely to sue you for malpractice. Then a doctor should be collaborative. A physician is member of healthcare team of doctors, nurses, social workers, psychologists, counselor, pharmacist and medical assistant. So it is a team of professionals with complementary skills. They work together to care for the patients. The doctor needs to share and respect knowledge and ideas of others for the improvement of health system. A good doctor should be honest. By building trust and honest relationship, doctors and patients can work together so that best care is provided. Then the doctor should maintain confidentiality. It is the duty of doctor that medical information of a patient given to the healthcare provider shall not be divulged to others unless the patient gives consent to disclose such information to others. Okay. Then the doctor should be optimist. Optimism means working in healthcare setup. There are many challenges or roadblocks or setbacks or less than ideal situations. So the doctor has to be mindful and should have the power to overcome it. Then the doctor should be patient listener. So it is time consuming, but active listening yields essential clues about the patient's health. Then the doctor should be confident. If a doctor believes that his skills to assess the patient concerns will lead to improved quality for the patient and is more likely to deal with the situation successfully. So the doctor should be confident to deal with the patient successfully. Then kindness is integral part of patient's experience. Patients are more willing to comply with medical treatments which lead to positive patient outcome. Then the doctor should have humanistic values. Humanism reflects attitude and behavior that are sensitive to values and cultures and ethnic background of others. Medical profession is considered noble profession and doctors are compared with God. By maintaining high ethical and moral standards, the physician should protect nobleness of profession. Participation in scientific research enables doctors to evaluate their practice objectively and involve in advancing their discipline. Thus, a doctor needs to improve scientific knowledge. Research is valuable tool to understand disease complexity, disapprove false reports, create knowledge that is reliable and authentic. In the present day, doctors have become service providers and their patients are consumers. Thus, it has become essential among professionals, medical professionals, to be aware of ethical and legal issues and code of professional conduct. Honesty and trustworthy approach of doctors have clear health benefits. As all of us know, patients will follow treatment plans, they will share medical information, they will take preventive measures and have better compliance. A physician should apply adequate knowledge and skills in saving patients' health. By keeping clear, accurate, and timely patient records, effective healthcare is possible. A well documented treatment and outcome plan in medico legal context safeguards professional integrity of medical practitioners. Medical practitioners should be aware of national and regional health policies to strengthen government in molding health system for better organization of healthcare services. Effective communication by a doctor helps to gain medical information, enhances accurate diagnosis, counseling, and compliance to treatment plan. Seeking fame and publicity, advertising is considered as professional misconduct. Advertising as a part of marketing may mislead the patient and lose trust from medical fraternity. Unnecessary referrals or investigations should be avoided. A doctor should make relevant referrals only for investigations or opinions where it is genuinely needed. Malpractice, falsification, arrogance can ruin doctors' career and practice. A victim can seek action against doctors' negligence in the form of monetary compensation. He may file criminal complaint or may seek disciplinary action. Accepting material gifts can undermine physicians' obligation to provide fair services to all and may damage doctor-patient relationship. A doctor should avoid hastening to take action with high-risk medical procedures unless he is sure of its necessity and that the benefit exceeds their risk of harm. Thus, a good doctor is one who is successful in disease prevention, health promotion, cure, pain and distress alleviation, able to impart safe rehabilitation and palliative services. For progressing in the professional life, a physician has to be a lifelong learner. Lifelong learning means striking balance between confidence and doubt. Lifelong learning is a process of continuously scrutinizing and building on your practice to be the best doctor you can. Initially, we have many doubts. With the help of learning process, doubts get cleared and it enhances our confidence. Thus, with the help of continuous learning, a right balance is gained between doubt and confidence. So it clears our doubts and it builds up confidence. Continuous learning process, a person acquires knowledge, values, skills, and this builds up his confidence, and that person can work successfully in any circumstances and in changing environment. Process of lifelong learning involves cognitive part, that is learning to know, psychomotor part is learning to do, and affective aspect is covered by learning to work with others, that is teamwork and leadership, and ultimately learning to be a human being. Qualities of lifelong learners are metacognitive skills. So, this allows the lifelong learner to organize and evaluate thought process related to learning and problem solving. So, they have problem solving attitude. Second quality is self directed learning. So, these are self motivated people where the individual takes primary responsibility or primary charge of planning, continuing, and evaluating their learning experience. So, the responsibility of learning shifts from external sources like teachers to the individual itself. Third quality is self monitoring. It is self assessment of progress and recording the results. So the person has to identify his or her lacunae or gaps and has to bridge them through learning process. Fourth quality is reflective behavior. It is the ability to reflect on one's action, to take critical stance, and these people are continuously engaged in adaptation and learning process. Why there is a need to be a lifelong learner? Our medical field is continuously evolving and it is necessary to update ourselves to meet the complexities and unexpected challenges. With the advancement in medicine, technology, various equipments, dynamic changes have occurred in the treatment strategies also. Thus, a doctor has to provide higher standard of healthcare as expected by the patient and their relatives. To lead the dynamically evolving healthcare team, a physician has to update their knowledge and skills. Depending on the healthcare need of diverse population, government policies are continuously changing and there is availability of new treatment options to be followed by the physician. Considering all these factors, lifelong learning is mandatory for professional and personal growth. So, how to be a lifelong learner? When we interact with other members of healthcare team, we share and we respect others' information. When we participate in educational activities, we observe and learn from others. So we come to know our gaps and we take efforts to meet our needs by learning process at our own workplace. A fruitful feedback from other team members will definitely improve our performance. We can make sensible decisions only if we seek solution for the challenges we face during our practice, that is evidence-based care. We should always keep a track on attainment of our goals and targets, that is commitment by us. So now let us see the scope and importance of lifelong learning. Through continuous learning process, we can update knowledge, we can gain new skills, and we can expand our intellectual boundaries. Medical field is ever changing with the advancement in medicines, equipment, surgical procedures. Physicians now has to strive for excellence. So making lifelong learning an obligation and not a choice. A physician has to apply basic knowledge and experience gained into the clinical practice. And common tools for updating recent knowledge is to read scientific articles, participate in journal clubs, conferences, workshops, hands-on training. So these are all tools which will assist the physician to take decisions. Again, lifelong learning with it will enhance professional as well as personal growth, and this will again lead to your career advancement, and ultimately it causes growth of healthcare system. So depending on one's interest, career choice, and life enrichment is possible. Healthcare is an ever changing field of practice with advances in medicine, expanded evidence sources, new treatment options, and changing government regulations and models of care. Lifelong learning is not a choice, but it is obligation. It is required by healthcare workers to remain relevant and continue providing safe, effective patient care. And lastly, in order to protect dignity, rights, and welfare of medical profession, a physician should constantly upgrade knowledge of ethical guidelines in clinical practice. So, we can draw a conclusion from this that lifelong learning helps to gain confidence in practice. Newly gained knowledge and skills is helpful in managing patients, and updated knowledge is supportive of best evidence-based healthcare delivery outcomes. Healthcare system is organization of people, institutions, and resources that deliver healthcare services to meet the need of target population. Now we will see the levels of healthcare system. First is primary level. It is the first level of contact between individuals and families with the healthcare system. In primary level, most essential or basic health care is provided. It includes primary health centers. Then the secondary levels are second tier of healthcare system in which patients from primary healthcare centers are referred to specialists in higher hospitals for treatment. It includes district hospitals, community health centers, and tertiary level of health system is one in which specialized consultative care is provided. Generally, they are referred from primary and secondary centers, and they include medical institutes and super specialty hospitals. Fundamental role of a physician in healthcare system is to manage indoor patients and outdoor patients. So the physician has to diagnose and provide medications to the patient and implement national health policies wherever applicable. And they should also contribute to the preventive and prophylactic management, especially in conditions like epidemics and other contagious diseases. Apart from being a professional expert, other roles of physician in healthcare system are leadership. So leadership is strategic and critical thinking, interpersonal communication skills, time management, integrity, vision. These are all essential in imparting effective healthcare delivery. Then the second is teamwork. Healthcare system is very complex. It involves physicians, nurses, pharmacists, surgeons, physiotherapists, nutritionists. So teamwork skill is essential for improving patient outcome. It will prevent medical errors, it will improve the efficiency and increase patient satisfaction. Third role of physician is to be a manager. So, a physician is responsible for maintenance of quality, safety for patients across continuum of care in both inpatients as well as outpatient settings. The next role is administrator. So, as a part of healthcare system, physicians are focused on managing resources, cost control, and create system level changes. And its next role is to be a mentor or trainer. So the experienced and knowledgeable physicians can educate his or her patients, relatives, and the health staff. So it is an opportunity to explore new perspectives and ideas by being a mentor. Now we will see the responsibilities of physician in healthcare system. So the professionals have to go through process of learn, unlearn and relearn. That means there is advent of some treatment strategies. So the physician has to go through it. After some days, new equipments or new medicines are evolved, so the physician has to unlearn previous treatment modalities and relearn the recent treatment, right? So there is learn, unlearn, and relearn procedure. So this entire spectrum begins from education and training, and it ends up in organization and practice in actual clinical setup. Then the physician should participate in national healthcare programs wherever it is applicable in community, such as family welfare programs, national tuberculosis management program. Then there are national programs for prevention of malaria and leprosy. It is the responsibility of healthcare members to judiciously use the resources and prevent wastage of government resources or expenditures. Then the physician should conduct surveys and community-based researches to evaluate the benefit of healthcare delivery. So, positive interactions, health education, promoting healthy lifestyle in a community can improve lives. So, with the efforts of doctors, lifespan of a patient or the onset of worse effects of illness can be extended. Contagious diseases and other epidemic conditions are huge threat to the health of a community. So timely measures and awareness by a doctor can curb or they can eliminate such catastrophic situations. A doctor maintains high ethical standards. In return, the community will give respect, trust, and they'll show confidence towards the doctor. So again, it is a responsibility of physician to follow or to obey ethical conduct in healthcare system. A physician should participate as social worker, should provide services to old age persons, slums, prisoners. Then the services, healthcare services provided by a physician should match the healthcare needs of that population. So there is huge diversity depending on the socio-economic status, gender, race, religion, geographic background. So because of all these factors, the healthcare needs of a local population depends on the disease prevalent in that area. So the physician should take care of all these things while providing services. Principal role of a doctor in society is to save life, extend life, improve life, and to control epidemics. By accurate diagnosis and management of disease, or by performing emergency or elective procedures, a life can be saved. By employing preventive measures in a community, the community spread of diseases, epidemics can be prevented. Positive interaction and promoting healthy lifestyle in a community improves life. With the efforts of a doctor, lifespan of a patient or onset of worse effects of illness can be extended. Contagious diseases and other epidemic conditions are huge threat to the health of community. Timely measures and awareness by doctors can curb or eliminate such catastrophic situations. Positive interaction, humanistic approach builds trust in patients, which serves as behavioral therapy in community. To protect nobleness of medical profession, a doctor has to maintain high ethical and moral standards so as to gain respect towards doctors by the community. A doctor has to generate and mobilize community participation in health programs through effective propagation of relevant information. Thus, by giving proper health education, the health of community can be improved. Doctor needs to involve in health promotion activities of community like family planning, immunization, screening programs, proper nutrition. Equitable distribution and rational use of healthcare resources to the community members is essential. The doctor should develop health policies that are suitable for community needs. Irrespective of race, religion, gender, socioeconomic status, geographic background, a doctor should promote attainment of highest level of health status among the community members, that is, health equity. Health resources should be ideally utilized according to the need of community. A physician, being lifelong learner, uses updated knowledge and skills to improve the quality of health services rendered to the society. A physician should conduct community-based survey and research to evaluate efficacy of healthcare delivery. A physician should conduct health awareness camps and participate in community affairs for the betterment of society.